What's up, everybody? It's Dr. Jeff from Rythmia Life Advancement Center here in Costa Rica. Today, I'm going to talk about empath strategies. A lot of the guests that come here are feeling a bit overwhelmed. They're feeling a little confused. They're very good people. They're usually in the healing professions, or they're people that other friends and family, gravitate towards and tell them their problems. And they're well liked by everybody, but they themselves feel overwhelmed and confused and like not sure like why they feel depressed and anxious, have drug addiction, alcohol abuse, they have suicidal stuff going on. They're like really confused because like everybody loves them and they're not sure like why this is happening. And when I talk to people, I say like, all right, let's figure this out. Did you have an abandonment issue when you were a kid? Did you have, were you abused as a little kid or as a teenager? Are you somebody that has been through a lot of trauma? And usually the answer is yes. And what happens, I think all people have this ability to feel the energy or the projection of other people. And some people amplify this tool in their life, and there's various reasons why they do that. And some of the reasons, for example, a lot of the guests that we have, some of them have been through really horrific stuff as kids. And there's a lot of abandonment. Now, a kid, when they feel that they're not wanted or they have to take care of themselves, what a kid does, a kid can't understand what that all means when it's happening. So what a kid does is a kid says, all right, I have to take care of myself completely. So I have to be on my own and navigate my life. And they're 5. So you can imagine a 5-year-old feeling this way, right? So like, what does a 5-year-old do if they feel like they have to navigate their life themselves? And the awareness and the consciousness of a 5-year-old is really different than us as adults. What a kid does at that age is they go, all right, somebody in this environment is dangerous or unpredictable. So I need to learn how to navigate this environment in a way that's going to keep me safe so I can survive. So the best way to do that as a child is to remove your own emotions from yourself, push them off to the side, and become an open vessel to receive the projection of other people and to absorb their energy. Because you can feel what somebody else is feeling, you know who they are as people. So if I'm in an environment, an unknown place, and I feel anxiety or sadness or anger from somebody, I can look around, I can go, wow, that's that person right there. That's who they are. That's their situation. Okay, but a child doesn't understand that concept. And what a child does is they absorb that energy to stay away from dangerous predicaments, to stay away from angry parents, stay away from dangerous neighbors or kids down the street that are problematic, or teachers that are abusive or demeaning or whatever. So what a kid does, if they feel that they're on their own, okay, that's the key. A kid that feels that they're on their own to protect themselves because their caregivers are not doing it, or they just don't know how, or they're just not around, right? A lot of kids, don't have abusive families or abusive upbringings, but the parents were working all the time. They had a nanny that was there, or they were on their own. They were latchkey kids, right? Remember that term, latchkey kids, right? They had to protect and navigate their own world. So what happens with that, right, is that a child learns that this is a very good tool. If they're in an abusive environment, like let's say their dad's an alcoholic and he's a drunk, and he comes home and he rages on everybody, gets pissed. Well, what a kid does, let's say the dad doesn't always do this. It's just 2 or 3 times a week. The kid knows that when that door opens, they're going to remove their emotions from themselves and absorb the energy of their dad. They can feel in that moment, oh, look, I'm feeling really upset right now. I'm feeling like anxious. That's my dad. So I'm going to stay away. I'm going to go to my room. I'm going to hide under the bed. I'm not going to cause problems. I'm not going to ask him anything. I'm going to hide. Right. And that becomes a safe way to navigate dad who's drunk. Or the next day, dad's in a good mood, dad's fine. The child absorbs a feeling of peace and calm. And then the kid knows, all right, dad's fine tonight, so I'm not going to do this. I don't have to run and hide. Okay, so this becomes a tool that children learn at a very young age on how to sort of avoid problems for themselves and stay safe. It's a survival mechanism. So if a kid is in an abusive or an abandoned environment for their whole developmental years, which are ages 0 to 12, then what happens is this sort of strategy gets locked into their life long term. They start to use it. They use it at school. They use it with friends. They use it with strangers. They use it with people that they're just meeting randomly. And they're very good at it. And they learned how to remove their own sort of emotional state and push it off to the side. And then they're just open and they absorb all this energy from these people, right, that they're around. And then if I feel something that's theirs, I know who they are. And it's very diagnostic. It's actually a really good tool. But what happens is a lifetime of this creates a disconnect in the person. And when they're in their 30s, 40s, 50s, 60s, they get to a point where they're like, who am I? Because I've just been absorbing everybody else's energy for years. I don't know who the heck I am. And I'm confused. I'm overwhelmed. I've been taking meds. I've been suicidal. I have a drug or alcohol addiction. And I just tell those people, you know what? You've been drinking and using drugs and taking meds and being pissed off and been suicidal for all the people that you've dealt with in your life. It's not you. It's not who you are as a person. It's not. It's not your own deal. So there's. I've said this before on some of my Facebook lives. You know, there's a lot of workshops out there that try to teach empaths like how to like safeguard themselves. And what they say is like, block the projection with some sort of energetic field. That's like ridiculous because that's going against the nature of an empath. So an empath needs to just be aware that they are absorbing somebody else's projection. Now, the only kind of people that project their dysfunctional emotions onto others are people that are dysfunctional, people that are sociopathic, people that have personality disorders, people that don't have the tools to deal with their own emotions themselves, and they're looking for targets to put their emotions onto somebody else. So if you're an empath, you probably have a lot of fucked up friends, right? Just to be blunt. You probably have a lot of friends that have a one-way street of projecting onto you their emotions and you holding it for them. And they feel amazing after they've talked to you and hung out with you, and they love to be around you because you just hold their emotions. And they go off about their life, you know, for the next couple hours feeling great. And you feel bombarded, overwhelmed, tired, anxious, sad. It is not healthy to absorb and hold onto other people's emotions. That's not what life's about. That's not what we do. Now, if you want to do this in a way that's clinical, you want to be a psychologist, you want to do this in a way that's like planned out and therapeutic, that's a different story. But that's not what I'm talking about, because most of you guys are not psychologists. You're not in a session getting paid a couple $100 an hour to do this, right? It's not what you're doing. You're going about your life and you're absorbing energy from people, and you have all these relationships in your life. You're the black sheep of the family. You're the black sheep. And the reason you're the black sheep is because you're absorbing everybody in your family's energy and all their dysfunction they're putting on you. Oh, so-and-so is just the problem child. So-and-so is the one that has all the issues. We're all fine. You know, mom and dad and brothers and sisters, we're all fine. But this so-and-so, Jane Doe, John Doe, they're the one that's got the issue. No, that's not true. They are dysfunctional. They don't know how to hold their emotions, and they're giving it to you. Okay, so you're the black sheep. So what does that mean for you? Well, I'll tell you. I learned this the hard way. You know, I had to become, basically I amplified my empath abilities growing up in the northeastern part of Los Angeles in the 70s, which was a rough environment, a lot of gangs, a lot of drugs, a lot of violence. And I learned that if I can unplug from myself, I can absorb the environment of I can absorb the emotions of my environment and the emotions of other people that are around me. I know who's safe. I know who's not safe. I can run if I need to. I can hide. Or I can be calm and relax and enjoy the company of somebody else. Okay, so I learned at a very young age how to do this. And what happened is that I progressed as an adult doing this all the time. I would absorb everybody's energy. I would understand who they are and move around them or just hang with them. And then what happened was I got to the point where I was totally overwhelmed. And I went into the clinical field of psychology because I was naturally good at helping people with their problems. Now, why is that? Is that like my nature? Is that like because of my interests? Is that because like, I had a knack for it? Well, yeah, all of the above. But the reason why I had a knack for it is because I had to do it to survive as a kid. And so when I was working at a facility in Los Angeles as an intern in my doctoral program, it was called the Sexual Recovery Institute. It was for nonviolent sex offenders. So these guys were really dysfunctional. They had a lot of baggage, and they were doing a lot of like weird crap. It was hard for me to like listen to and work with them. But I was doing what I usually do, which is remove myself from me emotionally and absorb their energy in the session. And what was happening is I was becoming bombarded with a bunch of really dysfunctional stuff, and it was weighing on me. And my personal life started to suffer. My family noticed that I was getting bogged down. I was angry. I was confused. I had a lot of issues in that time. And I was like, what the hell's going on? And then I had a breaking point where a client that I was working with, and he was doing pretty okay. And I worked with his girlfriend. We're trying to work towards a reconciliation. And all of a sudden they turned on me. And I was like, somehow I was the bad guy. I don't know how that happened. But what I learned is that the reason why I was the bad guy is because I was absorbing all of their dysfunctional energy. And I was pissed off. And one of my supervisors said, dude, come to this. After a group, we had a group supervision as clinicians. She pulled me to her office and she said, dude, this is what's going on. You're removing yourself from you in these sessions. You're absorbing their energy and you're holding it for them. You're not giving it back to them in a way that's like a corrective sort of healing manner. You're just holding it. And you think that's therapy. You think if you take away the burden of somebody that you're doing a good job. Guess what? You're not doing a good job. You're actually making it so they continue in their same dysfunctional pattern. I was like, well, what do I do? And she said, she was very wise, very good. I'll never forget her. She said, you lovingly, with empathy, give it back to them, to who it belongs. So, well, how do I do that? How do I give back somebody their dysfunctional projection that they handed over to me emotionally in a session? And so what she said, well, you recognize it's not you. You have to know who you are as an individual before you go into the session. And then you recognize it's not you, and then you hand it back over by pointing it out to them, saying, I'm sorry that you feel upset about that. That must be hard. Or, I'm sorry you're depressed about that. It must be really difficult to feel that way. And you just call it out, you just kind of point it out to them. And then what happens is the person that you're working with or talking to, or your family, your friends, whatever, whoever it is, feels when you say that to them, they feel that they're not alone in the situation. They actually feel a little bit of support. They feel that they can handle the emotion they're dealing with. They don't have to hand it off to you, because it's not your job to hold all this emotional stuff from other people. Now, a lot of you guys that are empaths, you go to the grocery store and you're just walking through the grocery store and the produce guy starts to tell you his life story. And it's all problematic and struggles and all these strife. You're like, I must be just a nice person. You're thinking to yourself, I don't know why these people tell me this all the time. You're in line at the grocery store. The person in front of you turns around and just starts telling you everything. And they feel, you're such a nice person. I feel so comfortable around you. Okay? Why is that? Why is that? Well, aside from you putting off to the side your own emotional state, you have a green light above your head. You have 4 traits that allow people to do this. Let me talk about those 4 traits. Okay, number 1, you're a loving person. They can feel that. Number 2, you're a caregiver. They can also feel that. Number 3, you are perceived as emotionally stable. You might not feel emotionally stable, but you're definitely perceived that way. Okay, 3 things. Not bad. That's all good stuff. The 4th thing, the boundaries that you have with yourself are unclear. I'm not talking about boundaries with others. I'm not talking about boundaries that you have, talking to people, you have good boundaries, whatever. I'm talking about boundaries with yourself. So what this means is this: how much of your own emotional energy are you going to invest in meeting the needs of somebody else? So when I was working in Los Angeles, I had a private practice working under a psychologist that I was working with when I was a student. I had 15 patients a day. They were all different people. I had high acuity schizophrenics. I had high functioning attorneys. I had children. I had couples. I had people that are going through depression. I had drug addicts. I had people that are high functioning. All these different people. My own emotional energy had to be regulated about how much I was going to invest in that particular patient. I had to learn how to manage it. If it was always the same for everybody, like 24/7 blasting, the most emotional energy that I have all the time for everybody, guess what? At the end of the day, I was basically dead. I was exhausted. I couldn't even drive home. I lived in Laurel Canyon at the time. From Pasadena, that was about a 40-minute drive. I could barely make it because I was exhausted. But if I did the right strategy in this, no problem. I could do this every day. So if somebody was acutely schizophrenic, the goals of therapy were hygiene and brushing their teeth and that kind of thing. So my emotional energy didn't need to be invested like completely like out there. But then I had a 10-year-old kid who was being abused at home, was in foster care. My emotional energy was more broad. It was stronger for them, right? Then I had a woman who was being victimized in domestic violence. My energy was kind of in the medium, in the middle, because I needed them to do some things, but I was helping them support them, right? So it's this range. A high-powered attorney who's has anxiety at the social club, the golf club, where they're the president, right, was a little bit not as much invested, right, emotionally. Now, energetically, of course, I'm invested in all the patients I work with, but how much of my own emotional energy am I going to invest in meeting the needs of the other people around me? Now, what does that mean day to day, right? Okay, so I have an 8-week-old baby. My emotional energy is very invested. I have a 2-year-old baby. My emotional energy is very invested. I have a wife. My emotional energy is very invested, but she's invested in me. So it's like maybe 75%, 40, sometimes 60. I have a 10th grade son. It's like medium because I'm trying to teach him to be a man and learn to take care of himself. So it's a little different, right? Then I'm with my coworkers, my employees that I work with. Okay, where's my emotional investment, right? Is it like 24/7 like it is with my kids? No, it's not. It's not. Maybe 25% at times. Somebody's going through something that's about 50, 60%. I'm always gauging how much of my own energy emotionally am I going to invest in the people I'm dealing with and working with, right? And I have to be in check with that. How about a stranger? How about the guy at the produce market? Is my emotional energy that I'm going to invest in them the same as it is with my 8-week-old son? Hell no, it's not. Because it's a stranger, but I want to be nice. So it's 10%. Okay, so that's what allows me to survive emotionally as an empath, because I know where I'm going to regulate and manage my own sort of energy in the day. If I had unlimited emotional energy, I would probably be Buddha? I don't know what I would be, but it's like, it's not something that's like attainable for me in this life. Okay, so you have to be able to manage what it is you're doing as a person, who you're working with, what are your priorities. You know, when you go to a wedding and you sit at a table with like half the people at the table are unknown, a couple other people you know, you're the person that everybody starts talking to you about their own issues and their own problems. They're not doing it to the person sitting next to you. You're like, do I have a red flag on my, do I have a target on my head? Well, guess what? You do. You do have a target. The reason is because you're loving, you're caregiving, you're perceived as emotionally stable, your boundaries with you are unclear. So, how do you make those boundaries with yourself clear? This is the way. Okay, it's really simple. You got to practice it. Because I don't want you to change being loving or caregiving or emotionally stable. Don't change that. That's who you are. You need to be. That's really cool. Boundaries with self are unclear. This is how you do it. I'm going to be aware of who I am when I go into a public setting. I'm going to be aware of where I'm at emotionally when I go into a public environment. So let's say I'm at Rythmia. I'm in my office. I'm by myself. I'm hungry. I'm going to go get some lunch. Okay, up at lunch, there's 60, 70, 80 guests, right? And those guests are all super cool people, okay, but they're all dealing with a lot of stuff, right? There's anxiety, there's depression, there's addiction, there's trauma, there's all kinds of issues, right? If I go up there unclear about my own emotional state, what happens is I start to absorb all this projection from people. And they come at me and they're throwing it at me. They want me to hold it for them because I'm just like not clear with my own emotional situation. So what I do is as I'm walking up from my office in the clinic up to the Roots, the restaurant there at Rythmia, I say 4 or 5 things. How am I doing? Okay, I'm hungry. I'm not anxious. I'm feeling a little bit tired because I had to feed the 8-week-old baby Steele, last night, so I'm a little tired. I'm a little bit bummed out because I miss my daughter who's in college, right? It's a couple things I mentioned to myself. How am I feeling? Where am I at? I want to exercise. I didn't get to today, so I'm a little bit upset at myself. Okay, so you identify a couple, 4 or 5 things that you're feeling. Then I get to the restaurant. All of a sudden I feel sadness, deep sadness. And for about 2 seconds I go, damn, I'm sad. What the hell? I miss my kids. I'm upset. I shouldn't be working right now. I want to go back to Los Angeles because I miss my friends. That's BS because I wasn't feeling sad on my walk up. I'm picking up sadness from somebody. So I have 2 choices in that moment. I can go, okay, I know this sadness is not mine, right? So I have 2 choices. Can I look around this restaurant here at Rythmia? Can I see who has sadness? And look, that's the guy. That dude. He's sad. I can feel it. He's going through a lot with his family. He's sad. He's upset. Boom. Or I can say, you know what? I don't need to know whose sadness this is. It's somebody's in this restaurant, but I know I got some that I'm picking up on. So I need to get the sadness off of me. So if I recognized who it was, right, I can go up to that guy. I can go, hey, dude, how's it going? Man, you all right, dude? I'm sensing you feel a little bit bummed out. You'd be like, yeah, man, I miss my family. I'm here. They don't believe in this plant medicine. And you can talk to them. You can engage. That's the more rare case because usually it's a little awkward to go up to somebody and say, hey, dude, you sad? That can be a little weird if you're not doing therapy with them, right? So the more common situation is you just go, all right, I know that dude over there is sad. So I'm going to get this sadness off of me in a later date, like maybe in an hour from now. And what I'm going to do is I'm going to mindfully get it off of me through my own spiritual practice. And that can be exercise. I like to go surfing. I like to just, when I'm walking around the property, I'm taking a step. The sadness is off of me now. It's out because I know it's not me. I know it's not me, right? It's not my own sadness. It's this other person. I'm absorbing it. So empaths are a very common sort of state that we see at Rythmia with these people that would come here. And the reason is because they're confused. They think their anxiety, their depression, their addiction, all these things they're dealing with are them. And you know what? We all have things that we're dealing with, individuals, but people that have an empathic ability to absorb the energy of others for survival, for what they dealt with as children in order to navigate their life, to be safe and to feel who was the right people to be around and who to not be around, and how to not upset dad and how to not upset mom, how to stay away from that kid down the street or the neighbor, right? Those people amplified their ability. We all have the ability to be empathic. We all have it. But some of us have amplified that ability because of trauma, because of abandonment, because of neglect, because of survival. It's a survival technique. If you have this situation, right, you're a healer. And if you're not in the healing field, you will be soon. Because when you come to Rythmia, you're going to plug back into who you really are as a person. I can show you how to use this tool in the best possible way. So you can still be an empath, you can still absorb energy, but you can redirect it in what's called the corrective emotional experience. It's a psychological sort of strategy. So basically, I talk to you like you're a therapist, because you are a therapist for your family and your friends, and all the people you work with, and all this. They come to you, they bombard you, they tell you their issues, they feel great when they leave. You're the one, you're the person that helps them, you're the one. And you, in the meantime, are miserable. Everybody loves you. Everybody loves you. They can't wait to hang out with you, want to be with you. They want you around all the time. But you're like not happy. You're not doing well because you're holding these emotions for all these people. It is not your job to hold the emotional projection of other people. It's not your job. You can absorb it, you can feel it, and you got to redirect it back to them in a loving way that makes them feel not alone in it, but helps them deal with it themselves. You can teach someone to fish, to catch their own fish and feed themselves, or you can fish for them all the time. The best way to do it is teach them how to fish, right? That's how you're not going to fish for everybody. Come to Rythmia. I will. If you're an empath, I'll show you how to navigate this. I'll show you how to deal with it. This is like super key thing. So many of our guests are empaths and they don't even know it. They think that they're like crazy. They have a lot of med history and they say like, I have all these meds and all this stuff. I'm like, you've been taking those meds for your friends and family. Those aren't your emotions. You're holding everybody else's stuff. That's not even who you are. They're like, really? And it like dawns on them. Like it's real. This is not their own emotional state. They're holding it for everybody. I always say this. It's funny because I have a background in psychology, right? Why are psychologists so nuts, right? You guys know. Most psychologists are like crazy. The reason, they didn't start off crazy. The reason is because they are holding all of their patients' emotional projection. If you're working in a psych unit, a locked psych unit, you work with schizophrenic people and acute psychiatric and all kinds of psychotic stuff, you're holding that for 20 years, you're going to act crazy because you're holding all this stuff for everybody. You're going to turn out crazy. Why do people that work in addiction often have addictions? Because they're holding in the addiction energy for all their patients, right? Psychologists are like freaking strung out. They're so freaking tripped out most of the time because they don't understand this concept. They're holding all this baggage for all these people all the time. I'm telling you, it's not your job to hold anybody else's emotions. And if you're in a relationship where this is the deal and you're the empath and the person you're with is projecting onto you, and that's like how this relationship started, it's what it's about, Guess what? If you want to end that relationship, put up a boundary. Be plugged into yourself. Don't allow the emotional projection. And guess what? That relationship will end in about 5 minutes or less, because that person will be like, oh, you're not a target anymore. You're loving, you're caregiving, you're emotionally stable, but you're not, your boundaries are not unclear anymore. They're clear. So you're not a target. So I'm out, because that's what this relationship's about. A one-way street towards you to give you all this emotional baggage that I can't deal with. So if you're in a relationship that's like that, you want it to end, put up a healthy, good boundary of being plugged into yourself and connected to who you are as a person. And that person will quickly change what they're doing. They'll look for another target. They will. All right, you guys. Empath Strategies. I can talk for freaking 5 hours about this because it's really interesting. I love this topic. Something comes up all the time here at Rythmia with all the people that are here. And guess what they do? The first ceremony night, which is Monday tonight, I tell them, go up there. If I notice they're empaths, right, I say, go up there to the ceremony, and your intention is to get off of you all of this emotional baggage that's not your own. Get it off you. Move it out. And then you can plug into who you are as a person. You can see what you've become. You can see who you are really deep down. Because a lot of people that are empaths have no idea. They don't know who they are. They're overwhelmed. They think they're crazy. They have such low self-esteem sometimes. It's upsetting to me. I'm on a mission to help empaths change the view they have of themselves and to move forward in life in a healing manner. The way the world changes is that we're all empathic with other people, but we got to do it in a clinically appropriate way that allows every individual to have their own experience. Empaths change the world. Everybody has the ability to be an empath. Let's change it. Let's change who everybody is on the planet based on who we are as people. Let's do this. This is how things shift. All right, you guys. Pura vida. I love this topic. Come down here. I'll teach you. I'll talk to you one-on-one. I'll train you on how to do this. I've learned through the most freaking horrific situations how to handle this. I look forward to meeting you. All right, you guys. Thanks for watching. See you next week. Pura vida.